Okay, Stephen, tell us why did you choose to specialize in aesthetics? You have been studying a few different medical specialties. Why did you eventually end up in aesthetics?
So actually, initially, I was during my as a medical student, I was really focused predominantly in cardiology, and I always had an interest in cardiology, and I spent a lot of time doing cardiology and related attachments in cardiology. But then, as part of the medical school training program, teaching experience, students are exposed to different specialties. And one of them I ended up was going into plastic surgery. And then that was when I was attached to plastic surgery, I actually ended up falling in love with it and dumping cardiology altogether. And it was just completely kind of a 180-degree switch into something completely different, from medicine to surgery. So the plastic surgery really kind of just stole my heart on the spot.
Okay.
And then since then, I continued along doing my training in plastic surgery, and then the rest is history.
Okay. So what do you hope to achieve with by establishing Aquila Medical?
So it was always my dream and ambition to have my own clinic. Okay, and in order to really be confident and to open up your own clinic, you need to obviously build up experience and your training before you can really establish your own clinic. So it's not necessarily always about having the finances or the connection, although obviously those do help. But honestly, to really open up your own clinic, you must have the experience and confidence to cater to your patients to open up your own clinic. So by opening Aquila, what I hope to achieve is obviously it's part of a branding, it's a clinic. I offer these aesthetics, minor surgery, and wound care services, and hopefully as it grows, I can expand my clinic locally and overseas as an established brand.
Okay, so how do you seek to differentiate yourself from other aesthetics clinics?
There are a lot of aesthetic clinics in Singapore, and some of them have obviously very experienced doctors, and they've been around for much longer than I have. And one of the things I offered in my clinic is obviously it's not just purely aesthetics. I do love aesthetics, but I don't want to lose touch with some of my surgical skills and my other interests like wound care and surgery. So I think my clinic's a bit unique in the sense that I offer aesthetics and non-aesthetic services, which are the minor surgery and wound care as well. And I obviously help and offer services like telemedicine for my international patients, and also to help them in terms of e-pharmacy, which is like delivery of medication. So strictly speaking, I'm not just sitting here doing purely typical aesthetics, Botox and fillers. I do try to do medical aspect as well, non-medical aspects, or aesthetic aspect.
So the telemedicine part of it, is it for aesthetic as well, or is for?
It can be used for both. So if I have a patient from Russia or Indonesia or anywhere like this, then they can make an online appointment, and they set a time with me, and then we do a kind of a teleconferencing.
Like a consultation,
Yeah, consultation. Because it saves them from flying 7 hours over, or flying even 2 hours over, to sit where you are. So it's better to see them, assess them as much as I can, although, telemedicine doesn't replace me seeing a patient in person, because I still need to examine physically, touching, or whatever, seeing. But it gives me an idea whether is there any points for the patient to even come see me in the first place or not.
So it is usually used for like a first consultation?
They can use for first consultation, and obviously I use it for the ones who actually do end up coming for the procedures and treatments. They, when they go back, I don't want to lose them. I'm not the type of doctor who says, "Oh, I've done my job, bye-bye, you go home, I'll never see you again." I do have a certain responsibility where I will follow up with them, as long as it takes until they're happy and I'm happy, and then that's it. So there is some follow-up, because nowadays there are a lot of people who may fly overseas for treatments, whether it be it because it's cheaper or it's a very well-known clinic. But a lot of the feedback which you get from these clients and patients is that there's no follow-up. You know, they see the doctor, whatever's done, boom, and then they fly back to Singapore or they go back home, wherever it is, and then that is it. Any issues or concerns or post-operative or post-aesthetic complications, you go back to your local doctor to follow up on, which is not nice or fair to the patient, you know. So when you take on a patient, there's a responsibility. You go from start to end. You know, it's not just about doing the stuff and then wipe your hands off and then saying finish.
Okay. What are some of the common aesthetic treatments that people seek usually? So
aesthetic treatments are a wide range, okay, from head to toe, and very commonly everyone knows things like terms like Botox, filler, lasers, fat freezing, threads. So these are all very, nowadays aesthetic procedures are very common, especially in this part of the world, in Asia. Most people would have at least considered, if not have already done, some sort of aesthetic treatment.
Okay.
Ranging. But the other interesting thing is, even within Asia, although being very popular, different regions or different countries within ASEAN or Southeast Asia have different demands. Okay, so Singapore, they may have the population here may have a particular demand for a particular type of aesthetic treatment in comparison to places like Thailand, Malaysia, Indonesia, Cambodia, etc.
Okay.
Yeah.
So usually for Singapore, the demand for aesthetic treatment would be mainly Botox or like?
I think it varies, but from my own personal opinion is, I find the local here prefer more of the non-invasive treatments. But that's my own personal opinion and what I've observed.
Okay.
And
not invasive. Do you call it like cosmetic?
Non-invasive, like for example, like laser.
Laser.
Right.
Just to remove moles. I mean, dark spots. Is it the
like pigmentation or for like scars or acne, texture, stuff like this. Versus something more invasive would be like using threads or Botox where you have needles involved. Right, those are a little bit more aggressive or invasive. Okay, there's no right or wrong. It's just purely preference, demand.
Okay,
and that's it.
Okay.
And here I just find that people prefer more non-invasive treatment. But I think maybe times are changing. You know, this is not the end all and be all, but what it is currently, I find, in my opinion, is that it's really more non-invasive treatments.
And you offer both. And you offer both.
I do offer both, of course. I think most aesthetic clinics would offer a wide range of services from invasive and non-invasive.
Okay.
You know.
What are some of the common misconceptions that people have on aesthetics treatment, and how do you address some of these misconceptions?
I think because there's a lot of aesthetic clinics out in Singapore, some of the things that people must be wary about is whether the clinic is trustworthy or whether they're running it from more of a business perspective where they only care about money.
But everyone does it for money. In terms of business.
I mean, yes, we're all business. We're all in the private sector. All the aesthetic clinics are in the private sector. And there is a certain element of business, but there's certain onus or some sort of ethics that should be involved where you're not here to cheat the patient or force them to do things unnecessarily, which is, I think, something that can be done, or some clinics may pursue in doing, in forcing people to do unnecessary treatments purely for a monetary gain, rather than from an actual aesthetic need. Okay. The biggest fear I think a lot of people have is it painful? Needles are coming in. Pain is usually number one. Okay.
That's for invasive.
That's for invasive, right? Cost is another big one. Okay. Obviously these are not for aesthetic treatments. They're not backed by insurance, or they're not subsidized, etc. So a lot of this is coming out of people's own pockets. Okay. So So I mean, these are usually the typical. And third and lastly, what happens if I stop doing it? So you tell me to do laser treatment for this, okay? I do the laser treatment. Okay, great. Now what? Okay, I've completed your 5-month, 6-month package or 1-year program. I stop now. Does it mean whatever I've done will come back? Does that mean in the future, because I've done so much Botox on my face will melt, etc. In the future, a couple of years down, a decade down the road. So these are some of the fears, but a lot of these fears can really be, calmed and quelled purely based on patient education.
Okay.
And I think that's very important, and I think that's what a lot of the aesthetic clinics are doing nowadays in terms of marketing on social media. It's more about patient education, not necessarily about Botox for $100. Okay, this has become, I think, coming down as well, becoming what is Botox. Okay, so that's some of the ways to combat some of the fears. But I think by far is usually the pain. The idea of pain and involved with money, which probably goes.
Is there something? I mean, just to set trend, is there something to mitigate the?
Of course, there's many things to mitigate, but I think the fear of needles.
Yeah, but it's always painful. I mean, aesthetic treatment.
No, really, but I've got friends, at the side.
No, but the idea of like a laser shooting your face or a needle going to your face. So people get fearful. Like if you go take your blood test for health screening, you automatically have a fear of a needle, even though you've done it since you were so many years ago.
Some people.
So it's a very similar type. And then there's other type of people. Other type of people, they just don't care. Some people are like, oh, I'm experienced. I know exactly what to expect. Do whatever it takes, etc., etc.
So for you personally, how do you deal with patients who, even though they may not need such aesthetic treatment, but they insist on doing the treatment despite knowing the risk? How do you deal with such patients? Do you agree to their requests eventually, or like?
I think it depends on what exactly their requests are. If they feel and they insist they want something, and despite me consistently telling them they may not improve, and they know exactly what they're getting into, and the type of treatment that I'm doing is not harmful per se, then there should be then I can do it, okay? Because they know what to expect, they know what the outcome can be, despite my advice, then of course then I can do it. They sign a consent forms, this is all done, but as long as there are certain things I would not do. For example, if they say they want more Botox on a certain area or more fillers in a certain area, despite me telling them in certain situations, if you inject too much, then it could, or if they're regular seasoned abusers of Botox, it can actually do more harm to their health than good. I'm not the one to judge per se what is beautiful, what is not. If you want big lips and you feel that is what you want and that is what makes you attractive, then I will do it. I'm not here to say big lips are bad, small lips are good, or vice versa. It's really what the patient wants. So if the patient wants big lips, even though in my mind I may not think it's very nice, but so be it. At the end of the day, it's what they want. I'm not a judger of beauty or stuff like this.
Okay. So we've read some news reports about some patients who underwent aesthetics treatment, and some of them, they got into accidents or some of them died, because they may have some pre-existing medical conditions, and so something went wrong during the procedure. So how do you ensure the safety and well-being of your patients are not compromised during the treatment and procedure?
This is a very difficult question, or difficult solution to get, because in those cases which you read in papers, there's a lot of factors to consider, and maybe some of them, maybe half the factors we don't know what's going on. We only can read what is published in the media, but there may be a whole bunch of stuff going on in the background which we're unaware of. But despite that, some things or some measures we can take to reduce such a risk is to ensure that a doctor is properly trained or properly experienced in whatever they're doing. Once again, some doctors are very enthusiastic and very confident, which is good. But at the same time, some of them they may not know their limits on when to say, stop, I cannot do this, maybe I should pass it to my colleague or someone more senior. So it's not, and that's one. And two, obviously regulations from SMC and MOH in regards on what procedures can be done, which is already implemented. So the issue is really, because there are so many clinics out there, it's not possible, or I don't think feasible, for people to check, an SMC officer or MOH officer to check constantly 24/7 in the clinic to make sure the doctor's doing the right thing.
Well, Adrian, are you also referring to, or are you specifically referring to the, what would they call it, the liposuction or something?
The
like
liposuction, yeah.
that? The liposuction.
I think I read in Hong Kong there was this woman, I think she had some pre-existing medical condition, then she
But there are
went
some
to-
cases in Singapore too.
Yeah,
Yeah.
Yeah, there was a liposuction case, I think.
liposuction, I think, yeah, there was this guy.
Do you do it?
No, I don't. Oh, no.
Oh, you don't do liposuction?
I don't do that. In Singapore, there's only two types of fields that can do liposuction. Either you're a specialist
Okay.
in plastics or general surgery, or if you're a GP, you can do plastic surgery, liposuction,
Okay.
but you must go for a course,
Oh.
training, proper training,
Okay.
and get certified, and get approved by SMC that you can do liposuction.
Oh, okay.
So I think there's some situations where doctors may think, oh, liposuction is so easy, you just take a syringe and you just keep sucking the fat. Who can't do that? But that's obviously not the case. It's a little bit more complicated than that.
Oh, I see.
And that's why I think, as I said before, it goes back to some doctors being enthusiastic. Some doctors in the clinics want to offer a lot of services. They want to encompass everything. They don't want to lose clientele. They want to build a reputation for themselves. So they go a bit overboard. They lose control, quote unquote, comes to this, and this is very dangerous, and even when I was doing my plastic surgery training, moving up the ladder, eventually, when I was senior enough, I would have my own interns or MOs, and then the first thing you tell them is don't be afraid to ask for help. You're not here to prove something, because these are real human beings, These are not like, corpses or anatomy lab where you can do whatever you want. So I always tell them, like, if you're stuck in trouble, don't worry about getting in trouble or stuff like that. The most important thing is patient safety, and make sure you seek help. It's better that you seek help and ask for help than you try to be a hero or try to make a point and prove something and something goes wrong. Yeah.
Okay.
Yeah.
So what are the things that people should consider before they decide whether they want to go for aesthetic treatment or surgery?
I think education. Nowadays, a lot of people use Google and whatnot, and they can find so much information on the internet to the point where I think it's almost overwhelming. It actually it may go over the top, and it may be information overload. But I wouldn't say don't do it. It's a good idea that you do some background information Google reading, so that when you do consult a doctor, which I think in every aesthetic treatments a client or a patient should do, is consult a doctor, not a nurse or a therapist, but a proper doctor. Then you can challenge the doctor by some of the things you've read, okay, and and ask questions. Okay, it's not the relationship with doctor and patient should not be I'm a father, you're the kid, I tell you what to do, you just say yes. It should be a mutual exchange.
It's about asking the right questions also.
Yeah, asking the right question, a mutual exchange of information where you are on the equal field as me. Obviously I have more expertise, I give you suggestions, but you shouldn't just take it for granted. You should challenge my questions, or challenge my responses. Yeah.
What are some of the common wound care treatment that patients come here for?
So, wound care is a very important and diverse area of medical care, which sometimes can be neglected or underlooked. And what happens is when this happens, the wound gets worse and worse, and then it comes to a point where, okay, finally, it gets really bad, then they go see the doctor. So never, underestimate a wound is the first thing. Types of wounds can range from something as burns, from cuts, scrapes, even if you hit your fingernail, and the most important, the bigger topic, especially in Singapore or in this part of the world nowadays, is related to diabetes, and public health education about diabetes. And for wound care, obviously in that aspect, it's diabetic foot ulcers, where they lose sensation, and the bottom of their foot starts eroding, and they don't know, that there's no pain sensation. And then, so diabetic foot care, foot ulcers are a very big aspect of wound care as well. Elderly, the geriatrics is another big issue in Singapore, the aging population here, especially for patients who are post-stroke or not very mobile, and they get bed sores because they can't move as much, and they end up sitting all day or lying in bed all day. So these are all different aspects of wounds. Okay, and so they do all come from something as minor as you were hiking, you fell down, you scraped your knee, and you say, oh, it's just a scrape, no big deal. I'm just going to continue my vacation, and then 2-3 days later you notice, wow, it's like red, it's infected, and then there's all this yucky stuff all over it. So it's become more complicated. Something as simple as that, all the way to something as complicated as I mentioned before, you know, the diabetic foot, the burns, stuff like that. So wound does come in wide range.
What are some of the implications that can arise if the wound is not treated, you know, in time and
So very so I mean there's all I mean in medical schools they always teach you short-term and long-term complications. But generally speaking, if you don't treat the wound and it gets worse and worse, several things can happen. Okay, you get an infection from the wound. So a wound that was initially just a simple abrasion, a breakdown of the skin barrier, because it's being exposed to the outside environment, gets infection, and then you get the fever, etc., and then it goes into your bloodstream, you get sepsis, and then off to hospital you go, into ICU. Very serious in that case, okay? The other thing can happen is locally is if the wound keeps breaking down, you may not have a fever, but it's not healing and it keeps eroding down until it gets into the bone or whatever's underneath, then obviously it complicates things a lot more.
can it be fatal?
Of course, definitely, without a doubt. Of course it can be fatal, yeah. So something as silly as something you just trip and fall and you neglect it because it's just a trip and fall can end up something you end up being in hospital because of that. So that's why it's very important not to just you know not to neglect simple wounds. Be vigilant. I'm not saying all abrasions or small cuts will end up you in the ICU in the hospital, but at the same time the whole point is preventing that in the first step from happening. Right. So the most important thing is the prevention.
Okay.
You know.
Okay. Is there a critical window period that patients should come and seek treatment for the wound before it gets worse, or?
Well, I think it depends on the type of wound. As I said, if it's something like a mild abrasion, you just trip and fall, you scrape your knee, I don't think you need to rush to see a GP right away. I mean, you can see how it develops. Maybe it's not getting better over the next couple of days. Then you should definitely go see a GP. Versus a wound, for example, you spilled hot water or hot soup, you know, onto you, then something like that, you should definitely go see a doctor right away. Okay, there's no hard and fast rule per se, but I think with some common sense, something more serious, like a scald burn or a fire burn, takes a much higher priority, lower threshold of seeing a doctor versus you tripping and falling and having a minor scratch on your leg or something. Or, you know, I mean, so there's no critical time. The critical time is when the wound is not healing or the cause of the wound was quite significant and to begin with, like a burn.
Okay. What about for diabetic wound care? I mean, it's like, how often does a diabetic patient needs to?
So usually with diabetic, they are under follow-up with GPs, and the GPs look after the diabetes will, aside from monitoring the sugar level, check things like their eyes and their feet for ulcers, potential ulcers in that area. So that's when the GPs start noticing. Usually it's from families and friends who notice that, hey, what's that on your foot? Like it's been there for ages, So sometimes your family and friends are close to you, or your partner, significant other, will tell you, okay, go see a doctor. It's been like this for a month, It's time for you to go see a doctor.
Do you do probably that's invasive, like for example, I want to change my face, to something else. Do you do that? Do you like go under the skin and shape bones? I think
I think something like that is I think one of the more popular things that's come up in the last few years is something like face transplant.
Face transplant.
For victims of traumatic accidents, like trauma, maybe car crash or whatever it is, to get disfigured.
Okay.
But these are very big operation procedures that usually go to tertiary level health centers or hospitals where you need the proper support. These should never be done in any outside clinic.
Okay.
And definitely for more major things like this should be assessed by a proper plastic surgeon or someone in facial plastic surgeon. It's different from if you're just saying you just want to tweak your face, slimmer or the wrinkles. That's something different. That you can get by. You can see an aesthetic clinic and get that done. But if you say you want to change your whole face, so it looks completely different.
Maybe this is something that's beyond my league, or my understanding. Because on social media you see a lot of before and afters, and they look really different.
So usually it's a combination of various procedures. Okay. So for example, very popular, commonly known is like in Korea. Very big in aesthetics. Okay, everyone knows that. Every young person, whether it be a girl or boy, now even men do it. Very popular there. They are willing to go under the knife for nose jobs, double eyelid, things like this.
You do that?
No, I don't do that here. No.
Okay.
These are much bigger cases that require like general anesthetic. It needs the proper hospital support, and definitely a experienced. Not just any plastic surgeon, but an experienced plastic surgeon to be done properly. Okay, because and you shouldn't definitely should not go to. I mean, there are ways to augment nose. There are ways to help with double eyelids, but I'm talking about if you want it done more or less permanently, like a rhinoplasty, like a nose job,
like a structural one.
like a structural one.
Like what we do to walls and all that. No?
Yeah,
Isn't
where
it
you
like
break it down
entire
and
space?
you build
Yeah.
something completely new.
Yeah.
Where it requires like proper surgery, that has to be done in the.
No, because I thought that if you're doing, then my question would be, how do you see someone who wants to look very different from what he or she originally looks like, and then of course I mean this has always been I think it's very much a personal thing. Just wanted to know your view.
Yeah, I mean, a lot of people they come in and they say, I want to look thinner, I want my nose bridge higher, I want this, I want. It's there's no right or wrong. It's your own personal preference. No one should tell you and say you are wrong. Your nose should not be like that. If that is what they want and they know that is what they want, and you can suggest some ways to fine tune it, but you cannot say that they're wrong and say no. You should do lip fillers instead of doing nose threads, for example. You can give this suggestion, but most people they come to you, they have something in picture already in mind. They usually say, I want to look slimmer, I want to look more of a slimmer face, I want a higher nose. They don't come really and say, oh, hi doctor, make me beautiful. I mean, you can say it casually like a joke, but in reality, a lot of the people when they come in, they will tell you what they want. You can give suggestions and say, oh, I wouldn't do the lips too big because it's out of proportion to the rest of your face. But they may say, no, I want it big. I want it like this picture, like in this picture, So it's okay. It's okay, fine, because that's what they view beauty as. Beauty is the eye of the beholder. It's subjective.
Of course.
There's no.
Because I'm trying to relate this to design, which is interesting. Like for example, sometimes in design we wanted very much to start from a clean slate. You can design anything that you want. But then there are some which are more like restorative. And then what is it that you want to do for restorative one?
Yeah, so it's different, right? So some clean slate or some for more reconstruction, right? And it's very similar in aesthetics and plastic surgery. It's reconstruction is reconstruction from trauma, from genetic defects or birth defects. That's very different from although I have a good nose, I want my nose to be the best nose. It's completely different ballgame.
Yeah, different story altogether.
All different story.
But I do feel that with certain emphasis, even for faces, I'm not sure, but even for faces, there's a certain emphasis, and then just by tweaking that, maybe the result will be astonishing already.
Of course,
right?
Of course, that's definitely the case. Of course, and stuff like this does not require
proportions and stuff.
Require major surgery. Like it would just be a couple of injections of Botox, or even just using some laser or HIFU or some devices, some of these devices, and changes can be quite significant. So not all aesthetic demands or wishes require surgery right off the bat. In fact, most of them should be done least invasive first and moving up the ladder.
So what you do is that after knowing what your client wants, you probably want to suggest something else.
Yeah, so
that he or she
sometimes,
has not have.
so sometimes the client
has thought of.
ask me for something. I may say, don't waste your money on doing fillers for this. Just go to a plastic surgeon or go to a hospital and get surgery done once and for all. Or else you're just wasting money. Or else, I mean, I don't mind. You're gonna keep seeing me every once in a while, but sometimes.
This is for something more permanent.
Yeah.
More structural.
Yeah, like, this is where some of the ethics or morals of
I
the
know what
doctor
you
come
mean.
in.
Yeah,
You know,
yeah.
there's no
Of
point
course,
in
you don't
lying.
mind them coming on a.
Of course, I don't mind them
regular
coming there
basis.
every 6 months or seeing me like that. But at the same time, it's like if you know the situation and they've already done injections before, it's not improving or very minimal improvement, forget it then. Tell them to stop wasting your money with you and just see a proper plastic surgeon or a specialist and get it done permanently once and for all. Okay, I mean it depends. So on a case-to-case basis, right? I mean that can happen. Or the other extreme is there's no need for you to go for such an extreme surgery now. We can easily correct your problem with a few threads or a few Botox mixed with threads, and the result is just as good as you going for surgery.
Like tricks.
Yeah.
And tips.
So it goes both ways. The key is, I think, the most important thing is to be honest with the patients, therefore establishing trust, and therefore them want to come back to you, rather than looking at them as like a dollar sign and seeing how much money you can take from them. That never works. That may work 1 time, 2 times, but
Yeah, of course.
it'll never last.
Yeah, of
if
course.
this is the type of drug, your type of
Looking long term,
mentality.
of course.
Yeah.